The World Health Organization has declared a public health emergency of international concern over a new Ebola outbreak in Central and East Africa. The urgency comes from how this began. The virus spread quietly for weeks before detection, creating a sudden, severe spike in cases. Now, international transit routes are on high alert. To navigate these new restrictions safely, we are going to build a personalized travel and health safety protocol. Take a moment to open a notes app on your phone or grab a pen and paper. We have a specific checklist to put together. When a fast-moving virus slips past early warning systems, centralized health responses take time to catch up. By having your own protocol in place, you close that gap and ensure your safety right now. Step 1 of our protocol is establishing exactly how this virus spreads, so you can accurately assess your own vulnerability. Looking at this diagram, you can see that unlike COVID-19, Ebola is not airborne. You cannot contract it simply by sitting across a room from an infected person or sharing the same air. Instead, transmission requires direct physical contact with infected bodily fluids, such as blood, vomit, or diarrhea, entering your system. This image shows medical personnel in full protective gear handling a deceased body. A major factor driving the current outbreak involves traditional funeral customs in the affected regions, where grieving families intimately wash and dress their deceased relatives, bringing them into direct contact with the highest viral loads. Because it primarily infects caregivers and grieving families tending to the sick, health experts refer to Ebola as a disease of compassion. Recognizing this requires travelers to evaluate their risk based on physical proximity and contact, rather than just being in a specific city. Step 2 is preparing for the strict health screenings now active at international transit hubs. This map highlights the geographic zones triggering these protocols: the Democratic Republic of Congo, Uganda, and South Sudan. Due to the incubation period, authorities enforce strict entry rules. The United States has banned entry for non-citizens who have been in these high-risk zones within a 21-day restriction window. If you are transiting through major international hubs like Delhi, Hyderabad, or Montreal, you will encounter specialized procedures. Here, a health official monitors a thermal imaging screen, specifically looking for passengers with elevated body temperatures. You are required to immediately report any of these symptoms to airport health officials: fever, weakness, muscle pain, vomiting, diarrhea, and a sore throat. Write these down. If you feel unwell during transit, hiding your symptoms is dangerous for you and everyone around you. Early, honest reporting ensures you get immediate supportive care and acts as the primary firewall preventing further global spread. Step 3 covers the practical hygiene and prevention rules you must follow if traveling near affected regions. Rule 1. Strictly avoid raw or undercooked meat. The virus originates in wild animals, like this fruit bat, and jumps to humans when bushmeat is improperly handled or consumed raw. Rule 2. Maintain absolute physical distance from the deceased. If you are attending a funeral in an at-risk area, you must avoid participating in any customary washing or preparation of bodies. Rule 3. Practice standard decontamination. This microscopic view shows how ordinary soap compounds instantly shatter the lipid envelope of the virus particle. Regular, thorough hand washing is highly effective at neutralizing it. By adhering to safe eating practices, avoiding high-risk contact points, and maintaining strict hand hygiene, you remove the pathways the virus uses to travel. You become a dead end for the infection. Step 4 is monitoring the global medical response, which tells us when international travel safety will return to normal. In this photo, an official presents the World Health Organization's Ebola response roadmap. Current containment efforts rely on deploying international experts for contact tracing and the release of $60 million in emergency UN funding. However, this outbreak faces a major medical complication. It is driven by the Bundibugyo strain, an extremely rare variant of the virus. This timeline illustrates the problem. Our existing vaccines and treatments were designed for the more common Zaire strain and do not work here. It could take up to 9 months to develop and distribute a vaccine effective against Bundibugyo. During this 9-month gap in medical countermeasures, we cannot rely on a pharmaceutical fix. Your strict adherence to personal hygiene, safe travel practices, and symptom monitoring is the only reliable defense. Let's review your completed protocol. You now know the virus spreads only through direct contact with bodily fluids. You have the exact list of symptoms to self-report at borders, and you have the strict hygiene and dietary rules necessary to avoid exposure. Before booking any future international flights, always check the official government travel advisories, specifically for East and Central Africa. Take the symptom checklist and the rules you wrote down earlier and save them to your phone's lock screen. This ensures you have immediate access to them during high-stress moments in transit. Moving away from generalized anxiety and toward a targeted, prepared protocol is exactly how we protect ourselves and the global community. Share this information with anyone you know who is traveling soon, and stay safe.